Hi, Dr. Woodhouse. We're just continuing our interview, and we just interviewed Erin, and I want to introduce you to Erin's mom, Tracy. And I think maybe you can give a better perspective on from your standpoint, because, I know Erin's happy that she's doing better stuff, but sometimes, young adults don't quite, you know, they're not able to say how dramatic the improvement was and how much better she is. So maybe you can talk from your perspective.
Sure. We did everything that you normally would do when your child has headaches, to try to discover what is wrong, to try to make them feel better. When your child has headaches that just won't go away, and it continues for a long, long, long time, it becomes clear that there's something more that you really can't address it yourself. So we took her to her primary care doctor, who, based on family history of migraines, because I have a history of that, and all of her symptoms and everything, thought it was probably migraines, and that what it needed was maybe to have the cycle of pain interrupted, that it just wasn't stopping, so that she could get back to normal, kind of, the idea of resetting her pain sensors. So so she did try, I don't even remember what the medicines were, but pain medicine to try to get it to stop once, the Elavil for a preventative, tried a number of things, and it was not successful. And so after it continued, the doctor then ordered the CT scan, which didn't necessarily show anything, but didn't rule anything else out.
But I mean,
other than tumors,
right?
I mean,
Because at that
was
point,
a big
you
thing.
got to start thinking, there's something wrong with my daughter.
Sure, and I'm scared.
Yeah,
I'm
right.
thinking my
Yeah.
child is not functioning. My
Yeah.
child is not able to go through a whole day of school. My child is, all of a sudden during the middle of a church service, faints. My child is getting sick when we drive in the car because she's so dizzy. I mean, she's cranky because she doesn't feel well. She's not sleeping. She no longer has an appetite because she's just all messed up. So after the CT scan, and the doctor also did some blood work just to rule out some, I'm not sure exactly what, but
Just
things that doctors know
right,
about.
Yeah.
And then she referred us to an ear, nose, and throat specialist so that we could have her ears checked to make sure that there was nothing causing the dizziness related to her ears. And her ears were perfect, no problems whatsoever. She doesn't have allergies, so that didn't provide any possibilities. And so we eventually went to the pediatric neurologist, where she got to have the EEG and the MRI and the MRA, and those did not demonstrate any problems. Everything was very clear, but the headaches continued, the dizziness continued, the inability to sleep continued. So the pediatric neurologist, after doing all of the basic neurological testing to eliminate, possible epilepsy and, different types of things, said, I don't know what to do with her. She's not responding to pain medication. She's not responding to preventatives. Why don't you try chiropractic care? He said, I don't know how you feel about it, but some people have had good results and they recommend it. So it might be something to try. It's something you haven't tried yet. Yeah. And so that was how we came to have your business card and give you a call. I think the thing that convinced us to go ahead with the therapy was the way you treated my daughter. That was the number one thing, because when she came in here, you did not ever treat her like a little kid, and you did not ever act like she should not be part of the decision-making process. And she responded to that, and I could see her say, oh, you're asking me what I think. And when we left here after the first meeting, she said, I really want to do this. I really think that this could help me, and I like the idea of doing it without medicine. So that combined with the things that you were talking about were things that I'd read about, things that were familiar, and I knew that had a scientific basis. I thought, well, it's worth it to give it a shot.
Well, I mean, at that point, I mean, your options were limited anyway. You know,
Yeah.
you'd run through the gamut of tests and medicines and all that, but the good news is, I mean, you could at least breathe a sigh of relief that she didn't have anything seriously wrong, you know, tumor, epilepsy, ruled, all
Sure.
that stuff out. So that stuff was good to get that all done. And you know, when someone that age has these kind of problems, then you start thinking about that. But that's the thing about, you know, when she came in, and I told you, I go, I'm gonna have to evaluate it. We don't accept everybody if she's a candidate, you know, and she is the candidate. You know, I mean, not you, you know, not them, and that's why, you know, when I'm testing her, you know, I mean, I'm getting input from you and stuff,
Sure.
because you're her mom and stuff like that. But that's interesting you said, because I never thought about that before. But anyway, she's done real good. She's on the tail end of her treatment. The migraines are gone. The dizziness is gone. We're still
She's sleeping, she's
but,
eating,
yeah,
she's
and she's doing real good.
relatively normal.
Yeah, we just want to get her to where she can, you know, sleep, you know, better than that, and that's the last, you know, phase that we're doing and stuff. But anyway, okay, well, I appreciate you doing that. And then, you know, one thing too is, I know that, you know, this treatment was a lot different than anything else that you've done, and it wasn't covered insurance, and it was expensive, but, you know, you got your daughter back, and was it worth it?
I believe it was. There's, once those life or death things were eliminated, then I was left with, what is her quality of life gonna be like? Is she gonna spend the next 80 years in pain? And how is that going to affect her personality or her ability to have a job, to go to college, to do those things? So, you know, how do you put a price on your child? She keeps telling me, I need to come and see you now.
Yeah.
Okay, now, Mom.
Well, I did tell you that once we get her fixed, then we'll visit with you, you know, so I mean, if you wanna feel as good as her, we'll talk about that. Well, listen, I appreciate, you know, you doing this and, you know, allowing me to treat your daughter, and we've had a really good resolution to this. So I think this is an interesting case for other people to look at, because, I mean, at that time, you know, had your neurologist not referred you to me, and he sent me other patients, other, you know, pediatric, you know, migraine and headache cases and stuff, I mean, she'd still be having a problem with that.
Yeah.
And we're just trying to get the word out, because there's a lot of young kids that have this kind of problem. That's not rampant, like, you know, like I told her, I go, you're gonna have more adults that have this than her, you know, but when they have it, then we need to get on it right away, especially when you've done all these other things. So I appreciate it, and you know, we showed your husband, didn't we?
No.
No, he was actually supportive.
He
She was
was
messing
very,
with us.
very
No,
supportive.
He was great. I met
He
him,
was-
and he's just happy to have his daughter doing good again. You know,
Exactly.
he was really good. I know she's messing with us. All right. Well, thank you very much,
Thank you.
Tracy.